professor, physician, epidemiologist. I am Dr. Sri Banerjee.
Hi, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And I'm proud to announce today is No World Tobacco Day. So today is a good day to kind of think about the harmful effects of tobacco and tobacco consumption. And this is pertaining to first, second, and third-hand smoke, and also in terms of polluting the environment, the non-biodegradable butts are in fact an issue as well. So these are some of the areas that I'll be discussing in this clip. So since this is a World Health Organization campaign, I'll start off with the World Health Organization talking about World No Tobacco Day. So just thinking about how it's celebrated, it's informing the public on the dangers of using tobacco, the business practices of tobacco companies. So it's not only placing the blame on the individual, but also the systems that allow for this to happen, and what the World Health Organization is doing to combat the tobacco epidemic. So it's a day for people to claim their right to healthy living and to protect future generations. So this was actually enacted and passed as a resolution in 1988, and then the dates have been kind of different. So there's a World No Smoking Day. So there's several topics that look at certain specific areas. So there's actually World No Tobacco Day threat to our environment. So this is where there's a discussion on what was left over from the cigarette, with the non-biodegradable butts littering our oceans and littering our environment. So there's a Commit to Quit. There's a Tobacco Exposed, The Secret's Out. These are from previous years. So you can kind of go through these. Also, in commemoration of today, and trying to understand this, the topic of smoking better, what I did is I created a map, and this, to me, this shows that this is in fact smoking is in fact a social issue, because of the fact that there's so many complex socioeconomic aspects that need to be dealt with when you're thinking about the behavior of smoking. So this shows that it's not all evenly experienced by all people within the United States. If you look in the Appalachian region, it's in higher proportions, smoking rates. Also in Pennsylvania and going into New York, there's higher rates than you see in Massachusetts, Connecticut, and all of these areas. Out west, you'll see similar kind of in areas where there's casinos and things like that, a higher preponderance of smoking, and some areas, pockets in Arizona. So these are places to focus on. Something else that is interesting that is provided through the Centers for Disease Control, I'll show you, is that people are more likely to quit in the Northeast for some reason. So maybe interventions or campaign against quitting tobacco use might be more effective in certain regions as well. So these are all ways that geospatially you can study this better. I'll provide a link to this map, so that you yourself not only can take a look at all of the values, but also potentially use this for your research. The third segment I'm going to go over in this video is looking at some of the Centers for Disease Control resources. And if you're interested in conducting research in a specific area, and not just looking at tobacco use as in a whole, but decide to look by geographic region, for instance, what I went over in the original map that I created, or just looking in more general terms. Sometimes simple general terms provide more of an overview than looking for more specific complex topics. So sometimes just dividing the country up into regions and then going into the frequency and the percentage in each region that engage in cigarette smoking is more effective than looking at it geospatially. So here you can also see kind of urban versus rural areas. So after this, if you had some geospatial maps, I think that would provide much more of a clear picture of what is going on. But some of the patterns, Midwest seems to be an area where there's highest among individuals who smoke. So also out west. So intermittent smoking is more experienced out west than Midwest. And then smokers live in rural areas are more likely to smoke more cigarettes, so 15 or more cigarettes per day, than people living in urban areas. And then adolescents, rural regions began smoking earlier in life than people that engage in daily smoking in rural areas. So, and some of my original smoking studies, epidemiological studies, were actually among adolescents in urban areas. So looking at the health effects, of course, the number one cause of death attributable to smoking not only is in Kentucky and West Virginia, and that actually correlates well with the map that I shared with you, where there's higher prevalence. So it's good to know that that corresponds, but also that lung cancer incidence is highest in the South and lowest in the West. For some reason, it seems like this is more strong of a risk factor in the South for lung cancer, smoking. So coronary heart disease and stroke rates are higher in the South. And then COPD hospitalization risk is higher among people living in Appalachia. So that means that it's not necessarily the diagnosis, there's not more frequent diagnosis, maybe, but more importantly, it's that the severity of COPD is more. Potentially, maybe there's other pollutants. So for instance, as we all know, when you're exposed to asbestos and some environmental pollutants, when you engage in tobacco smoking, then there's an additive effect between the environmental pollutant and the risky behavior. So these additive effects are important to see in the context of what is going on within the region. So in the Appalachian region, occupational exposure that would cause lung conditions are much more frequent. So then goes into some secondhand smoking, but then quitting behavior. This was the interesting piece where it said that percentage of people who quit smoking are higher among those living in the Northeast than any other region. So from the marketing industry, what has happened is the tobacco industry has classically targeted young rural men by presenting the image of rugged individualism, about Marlboro Man, and cowboys, hunters, race car drivers, things like that. So youth in rural areas do not get exposed to the anti-tobacco messages in the media as well. So there's a paucity of information. And then low income and predominantly minority neighborhoods often have more tobacco retailers. And so there's more advertising. More advertising means more pressure to purchase, and then there's a higher frequency. So people who see tobacco promotions in places where tobacco is sold are more likely to smoke. So these are some resources that are good to look through with the Centers for Disease Control. Also looking at how tobacco smoke is in terms of disparities. So I encourage you to look to the right, actually look to the left, the menu items, and take a look at some of the specific areas. And then go from there. So that this then can springboard into your not only your original research, but also understanding the gravity of the public health epidemic of tobacco use. There's still broad swaths of places where tobacco use is quite prevalent, and even though broadly the prevalence rates might have declined, there's places where there's work to be done in terms of interventions and behavior change. Thank you for listening.